Okay, we're going to do a upper nerve conduction, and we'll do it on the right arm as well. We'll start the same way. We'll double click on the Sierra Wave logo. We're going to select New Exam. Put the patient information in, last name, first name, birth date, male or female, the doctor, the birth date, put it in as well. Complaints. You can do neck pain radiating to the bilateral arms with associated weakness. Hit done. Move down to the patient history exam. Type that in from the doctor's notes. Done. Start exam. This time we're going to select bilateral upper. Once again, the nerves are all listed here. We're going to start with right median sensory. For this one, you also want to make sure that the patient doesn't have any lotion on their hands or their feet. If they do, send them to the restroom, wash their hands. It's going to make it a lot easier with you placing these pads on them. Right sensory median. The electrodes are going to be placed on the index finger. Tabs facing this way. Makes it easier when you're hooking the wires up. Ground goes in the back of the hand. Tab facing this way as well. Electrodes, active, towards the heart. Reference, next to it. Ground, behind it. Okay. Sensory stimulation points are just going to be 1 for each sensory nerve. Motors are going to be 3 apiece. You'll have F-waves as well in there. Put a little gel on the tips again. Always put gel on the tips before you start. Place the electrodes facing down. Check your polarity. Polarity needs to be facing this way. I'm going to turn this up to maybe 12 or 15. We're going to stimulate right in the center between the 2 tendons in the center of the wrist. Press down, stimulate. Perfect. Once again, with sensories, it's marking peak and trough, not onset. Everything's marked correctly. It looks good. We can move on. I'm going to hit number 2, which is next, which takes me to the right ulnar. The right ulnar, we're just moving the electrodes over onto the little finger. Ground stays in the same spot. Here I'm going to bring the electrodes out, more gel, check my polarity facing this way, and I'm going to stimulate right about here. Turn up the stimulation to somewhere in the 10s. I'm going to start off at 12 on her. We're going to stimulate right here, one time. If you look at the screen, several waves are apparent here, but the wave we're looking for is usually the larger one, about an inch in from the left. It's marked correctly at peak and trough. We're happy with that. We're moving on to radial. We're going to hit number 2, which takes us to the next nerve on the list, which is radial. We're going to take these 2 off. We're going to turn the hand perfectly sideways. We're going to put the reference electrode on the knuckle, the active electrode. If you close the thumb in, you'll see where this crease is. We want to put it right at the end of the crease. We're going to mark from the center of the electrode, we're going to mark 16 centimeters up. I'm going to put my thumb there. We're going to mark across there. Oops. And we're going to stimulate right at the top of that. I'm going to put the electrodes down. More gel. My polarity is correct. You want to make sure that the hand is straight up and down. Very important. And you stimulate right on top. Turn it up. Usually I try to go into the 30s on this one. It's a little bit more difficult to get. I'm on 36 on this one. And the electrode where the light is always going to be on the line, by the way. I don't know if I mentioned that earlier. Okay, if you bring it back over here, you'll notice that the wave is here. It's not marked correctly. So I'm going to put the peak at the top of the wave, trough at the bottom of the wave, and we're going to move on to the next one, which is median, right median motor. So we're going to hit 2 to take us to the next wave. And we're going to move our electrodes from here. We're going to take the 2 off, leave the ground on for the entire test, by the way. We're going to place the the reference electrode on the thumb knuckle and the active electrode right in the meaty part of the palm of where your thumb muscle is. Okay. And we're going to move the electrodes down. A little more gel, turn it up. I'm going to turn it up into about 12. I'm going to 14 on this one. We're going to stimulate the same point that we did on the median sensory. I always support them underneath. That way you're not pushing them away and they have to support themselves. Okay? Got a nice wave there, and with the other motors, on the lower motors, we had 2 stem points. On the uppers, there's 3. 3 for the median upper and 3 for the ulnar upper. So, from here we're going to continue to our second point. Before we do that, we have to hit store, because if you stimulate your next point and you don't hit store, you're going to stimulate over your other line that was there already. So we're going to hit store, which makes that line purple, brings this one to white, and we're ready for our next stem point. For this one, I usually straighten out the electrodes. I'm going to change my polarity so it's facing this way. The median nerve travels from the center, and then right at the elbow it curves, facing towards her heart this way. So I want to stimulate one here. From there the nerve travels up in between the bicep. We're going to stimulate the third one here. So the second one's here. We're going to check my intensity. We're going to go up to about 20. I'm going to place it here and hit it. Perfect wave, looks just like the first one, which is what you want. It's correct. We're fine with that. We're going to hit store, move to the third one. We're going to have the patient bend their arm and lift up a little bit. And we're going to go just about halfway between the elbow and the armpit, and we're going to stimulate right in between those 2 muscles. I usually kind of face up and push up, stimulate, boom. Look back over here. We got all 3 and they're perfect. We're happy with that. Now we need to measure in between those points. Have the patient straighten their arm out as straight as they can. Once again, I'm going to go from the first point to the first point to the first point in centimeters. So we're going to stimulate, this is going to be 23.5, and this one's going to be 11. So we're going to hit number 1. We're going to go to 23.5. Hit 1 again, it goes away. Hit 1 again, it comes back, and we're going to go to 11. And we're going to hit number 1 again, which takes it away. That completes the right median motor. We're going to hit next, which is going to take us to the F wave. F wave, the pads stay in the same spot and the stimulation point is the same spot. Put the electrodes down. Remember your polarity is reversed, so for F waves, okay, so you make sure the light's facing the opposite direction. Get a little bit of gel on there. You want to turn it up probably into the 20s. For someone thin, you're going to need to go higher if you need to for someone that's a little thicker. Support underneath, stimulate 1 time. Okay, if you look over here, I've got a little bit of a wave here, but I'm not really happy with it, so I need a little more stimulation, a little more electricity here. So we're going to turn it up to 39 and stimulate 1 time. Boy, look at that one, that's perfect. It's huge. I'm happy with it, so we're going to hit F1. It's going to turn that purple, and it's going to allow me to do several of them. So from here, we're going to go to that same point, and we're going to hit 4 or 5. Those are fine right there. From here, we take the blue line, we click it until it turns yellow, we bring it over to the average of all those bumps. I'm happy with it. We're moving on. Hit 2 to take you to the right ulnar motor. We're going to take these over, and on this one, you want to put it a little bit closer to the side of the hand for the active reference, the same way. Now our 3 stem points here are going to be right here, which you'll see me do. We're going to do before the elbow and after the elbow. I'm going to straighten out my electrodes, gel. My polarity is wrong, so I need to change it. We're going to turn this up to 12.5 or so on her. We're going to stimulate 1 time. I like it. I'm keeping it, so we're going to hit store. You have to hit store in between for the motors. We're going to have her lift her arm up and bend it a little bit. Now on this one, you notice I'm kind of going down low and also at an angle. Okay? This one sometimes takes a decent amount of stimulation to get to. It's kind of hard to get to. If you look back at the screen, it's perfect. I'm happy with it. We're going to hit store again because we're doing 3. And this time we're going to go right into that concavity right there, right where our funny bone is. And you're going to put the black electrode, or in this case, the where the polarity is, the green light. We're going to stick it right in there. We're going to hit it again. And you'll look that all 3 of them came out really nice. I'm really happy with them. Now we need to measure them. Since there's more than 1 point, straighten the elbow out from the first to the first to the first. In this case, it's 21. and 4. So to do that, we hit number 1. We're going to go 21, hit 1 again, it'll go away, then bring it back again, and then we hit 4. Then we hit 1 again for it to go away. That completes the right ulnar motor. We're going to hit number 2, which is going to take us to the ulnar F wave. The electrodes stay in the same spot. Polarity is reversed. Polarity is reversed. We're going to turn it up just to 20. We don't need much on this one. Ulnar is pretty easy to get to. And we're going to stimulate the same point that we did for both the sensory ulnar and the beginning of the motor ulnar. I'm going to stimulate once. Right away we got a good wave right here, right where we want it to be. We're going to hit F1 so it saves it and allows me to do more. And we're going to continue that same spot. Sometimes it helps to move the electrodes up and down. Okay, perfect. We've got a bunch of waves there. This one's a little trickier to mark, so pay attention. I want to look for the most prominent wave on here, which is here. So that's basically where the rest of them need to be. Even though there's a bunch of squigglies here, that can be because of the light above us. The fluorescent lighting can sometimes make the waves look a little weird. So I know it's going to be about here, and there's several of those bumps in that same line. So I'm going to move this over to right about there. I'm happy with that. We're going to move on to the right median and ulnar palm comparison. Real simple. To do that, we hit 2. This one, we're going to put the active electrode on the ring finger. Reference active. When you're putting these on, you don't want them to touch. You never want these two pads to touch one another. So you always have some space in between them. Okay? Now, we're going to stimulate 1 at the median and 1 at the ulnar. And we'll change our polarity. I'm going to push this down here. I'm going to stimulate 1 time. And you can see I got a really nice nerve here. Now, median and ulnar comparison is a comparison. It's the same test. So we're not going to hit 2. We're going to hit store, which is going to take that wave and turn it purple and give me the opportunity to do the same electrode placement, but I'm going to stim on the ulnar side this time. And you can see I got a really nice wave there as well. I'm happy with that. We're going to hit 2, which will take you to the left side. Once you're done with those, we're going to go back up to AV. We're going to hit it. We're going to select bilateral upper, which we'll do real quick. I'll show you. It's always going to come up as the right posterior and right anterior. We always want bilateral, so you're going to go down and select bilateral upper. Hit the second button here, and we can move it back and forth. You can see there's some red here, so there's some mild nerve damage. You do the same to the other side, and then we'll hit report. We'll wait for it to generate our report on the Word document, which once again is going to have all the information that we put in, the patient history, the patient complaints, the name, all those things will all be on that report as well, along with the name of the clinic and the doctor's name. Once this comes up, we do it just like the lower. Everything's the same. You hit save 1 time, and then you hit print. If you want more than 1 copy, you can hit print twice. That concludes the lesson for today.